Childbirth is one of the most powerful moments in life, and as a midwife, your words can make it safer, calmer, and more human. Hi, I'm Jer from Learning English Pro, the channel for healthcare professionals like you to improve your English and grow in your career. Today's lessons will give you 100 English phrases that are useful in maternity care, from early pregnancy all the way to birth and aftercare. We'll go through 10 key topics, each with 10 phrases. You'll learn how to communicate with mothers during prenatal checkups, labour and recovery, and how to explain common procedures, how to support someone in pain, and how to speak clearly during emergencies. There's even a section on speaking with partners and other professional communication with your team. If you'd like to download the full guide, you can get it as part of my student membership. Student membership with Learning English Pro gives you access to all my PDF guides. There's over 70 now, 200 exclusive English lessons, and the chance to request content on the English topics you need. Membership is just $4.99 per month. Or if you want to buy the guide as a one-time download, you can get it in my YouTube store. This video also includes several additional medical English lessons after the 100 phrases. You can find all the timestamps in the video description. Are you ready to begin? Let's jump in with our first topic, which is prenatal care. You'll hear each phrase twice. For more detailed explainers, check the guide that comes with the lesson. How far along are you now? How far along are you now? Please roll up your sleeve. Please roll up your sleeve. I'm going to check your blood pressure now. I'm going to check your blood pressure now. Do you have any concerns or questions you'd like to discuss? Do you have any concerns or questions you'd like to discuss? Have you noticed any unusual symptoms, such as bleeding or headaches? Have you noticed any unusual symptoms, such as bleeding or headaches? Let's listen to the baby's heartbeat. Let's listen to the baby's heartbeat. Everything looks good with the baby so far. Everything looks good with the baby so far. We need to take a blood sample for some tests. We need to take a blood sample for some tests. Remember to take your prenatal vitamins every day. Remember to take your prenatal vitamins every day. Your blood pressure and weight are looking good. Your blood pressure and weight are looking good. Well done. These first 10 phrases are core tools for clear, caring communication during prenatal visits. Let's have a quick test. Which phrase would you use to gently invite the patient to speak freely about their worries? Did you get it? The correct answer is, do you have any concerns or questions you'd like to discuss? If you're finding this lesson helpful, hit the like and subscribe. I release new medical English content every week. Next, we're heading into the delivery room with phrases to support mothers through labour and birth. You're fully dilated now. It's time to start pushing. You're fully dilated now. It's time to start pushing. Take a deep breath and push as hard as you can. Take a deep breath and push as hard as you can. Push when you feel the urge. Push when you feel the urge. One more big push. You're doing great. One more big push. You're doing great. Okay, stop pushing and take short breaths. Okay, stop pushing and take short breaths. I can see the baby's head. You're almost there. I can see the baby's head. You're almost there. Just a few more pushes and your baby will be here. Just a few more pushes and your baby will be here. Take a quick rest between contractions if you can. Take a quick rest between contractions if you can. One more push for the shoulders. Almost done. One more push for the shoulders. Almost done. You did it. The baby is here. You did it. The baby is here. That was an intense section, but don't worry, we're going to come back to this section later on in the video with even more phrases. These phrases that we've just covered are essential for guiding and supporting a mother through the most physically demanding stage of a pregnancy. Now, quick quiz. Which phrase would you use when the baby's head is visible and you want to encourage the mother to keep going? Got it? The correct answer is, I can see the baby's head. You're almost there. Don't forget, you can download the full PDF guide for this lesson as a student member or pick it up in my YouTube store. Now, let's explore the days after delivery with phrases for postnatal care and recovery. How are you feeling now, physically and emotionally? How are you feeling now, physically and emotionally? Let's check your bleeding and make sure everything looks normal. Let's check your bleeding and make sure everything looks normal. Try to rest whenever the baby is sleeping. Try to rest whenever the baby is sleeping. Let me know if you're in any pain so we can manage it. Let me know if you're in any pain so we can manage it. You're doing really well. It's completely normal to feel overwhelmed. You're doing really well. It's completely normal to feel overwhelmed. I'm just going to check your stitches now. I'm just going to check your stitches now. You may feel some cramping. That's the uterus shrinking. You may feel some cramping. That's the uterus shrinking. Let's talk about feeding options. What are your thoughts? Let's talk about feeding options. What are your thoughts? Here's how to hold a baby for feeding. I'll guide your hand. Here's how to hold the baby for feeding. I'll guide your hand. We'll keep an eye on your vitals for the next few hours. We'll keep an eye on your vitals for the next few hours. Great job. These postnatal phrases help create a safe, supportive recovery environment and show that emotional care matters too. Let's try a quick quiz. Which phrase could you use to explain why the mother might be feeling cramps? Did you get it right? The correct answer is, you may feel some cramping. That's the uterus shrinking. What's been your favorite phrase so far? Let me know which one you're most likely to use first in the comments below, and let me know where you're watching from in the world. I love to hear from my international students. Now let's move on into more urgent territory with phrases used in emergency situations. We're going to keep a close eye on this, and I'll stay right here with you. We're going to keep a close eye on this, and I'll stay right here with you. Your bleeding is heavier than expected. We're going to act quickly. Your bleeding is heavier than expected. We're going to act quickly. We're calling the doctor now to assess the situation. We're calling the doctor now to assess the situation. Take some deep breaths. We've got you. Take some deep breaths. We've got you. We're giving you something for the pain now. We're giving you something for the pain now. The baby needs some help, so we're calling the pediatric team. The baby needs some help, so we're calling the pediatric team. You're in safe hands, and we're doing everything we can. You're in safe hands, and we're doing everything we can. Would you like me to hold your hand? Would you like me to hold your hand? We're going to theatre now. Everything is ready. We're going to theatre now. Everything is ready. Your baby is okay. They're getting the care they need. Your baby is okay. They're getting the care they need. That was a powerful section. Being able to speak with clarity and kindness during an emergency can make all the difference. Here's your next quick question. Which phrase lets the mother know you're calling in the doctor for support? And yes, the correct answer is we're calling the doctor now to assess the situation. If you'd like more insight on each of the phrases, remember the guide for this lesson includes an explanation for each of the 100 phrases, and it's available now to my student members over on the membership tab. If you want to join the student membership, click the button beneath this video or check out the details in the video description. Now it's time for topic 5 already. Well done for getting this far. Our next batch of phrases deal with explaining medical procedures in a clear, simple way. I'm going to do a quick examination now. I'm going to do a quick examination now. You might feel some pressure, but it shouldn't be painful. You might feel some pressure, but it shouldn't be painful. I'll be as gentle as possible. Please tell me if it's uncomfortable. I'll be as gentle as possible. Please tell me if it's uncomfortable. I'm inserting the speculum now. Try to take some slow breaths. I'm inserting the speculum now. Try to take some slow breaths. This is going to feel cold for a moment. This is going to feel cold for a moment. We're going to monitor the baby's heartbeat for a while. We're going to monitor the baby's heartbeat for a while. You may feel a little pinch as I take the sample. You may feel a little pinch as I take the sample. We'll send this to the lab and get the results soon. We'll send this to the lab and get the results soon. I'm putting in the IV now, just a small sting. I'm putting in the IV now, just a small sting. We'll explain everything again before the procedure starts. We'll explain everything again before the procedure starts. Those last 10 phrases help midwives clearly guide patients through medical procedures, and that clarity can ease anxiety and help build trust. Here's your question. Which phrase would you use before inserting a speculum? And of course, the answer is 44. I'm inserting the speculum now. Try to take some slow breaths. This is a really great phrase for preparing the patient for some uncomfortableness. If you found this lesson helpful so far, don't forget to subscribe so you never miss a medical English class. Coming up next, phrases to support someone through pain and distress with kindness and professionalism. I know this is painful. You're doing so well. I know this is painful. You're doing so well. Try to breathe through it, nice and slow. Try to breathe through it, nice and slow. Would you like to change position? Would you like to change position? Let's try using the birth ball to help ease the pressure. Let's try using the birth ball to help ease the pressure. You're not alone. I'm right here with you. You're not alone. I'm right here with you. It's okay to cry or shout, whatever you need. It's okay to cry or shout, whatever you need. Take one contraction at a time. Take one contraction at a time. Would you like to hold someone's hand? Would you like to hold someone's hand? This part is the toughest, but you're nearly there. This part is the toughest, but you're nearly there. Let's try some gentle touch or massage, if that's okay. Let's try some gentle touch or massage, if that's okay. You are doing such incredible work. These phrases help midwives provide both physical and emotional care when it matters most. Okay, quiz time. Which phrase offers calm encouragement during a contraction? Did you get it? The correct answer is try to breathe through it nice and slow. Now let's move on to one of the most underrated areas, communicating with the partner or support person. Would you like to stay close and support them? Would you like to stay close and support them? They're doing well, just breathing through the contraction. They're doing well, just breathing through the contraction. You can remind them to breathe and hold their hand if you want. You can remind them to breathe and hold their hand if you want. Let me know if you need a break and I'll stay with them. Let me know if you need a break and I'll stay with them. It's normal for them to make sounds or feel overwhelmed. It's normal for them to make sounds or feel overwhelmed. Would you like a chair or a drink of water? Would you like a chair or a drink of water? You're doing great. Just being here makes a big difference. You're doing great. Just being here makes a big difference. Do you have any questions about what's happening right now? Do you have any questions about what's happening right now? Let me explain what you might see during the next stage. Let me explain what you might see during the next stage. You're welcome to step outside if you need a moment. You're welcome to step outside if you need a moment. Those last 10 phrases are so important. A calm, informed partner helps the mother and you more than you might realize. Here's your quick quiz question. Which phrase offers the partner a clear way to help without pressure? The correct answer is, you can remind them to breathe and hold their hand if you want. If you find that this lesson is supercharging your English, please give it a like and tell a colleague. We've got 3 more powerful sections coming up. Now let's focus on communication with the wider medical team. Can someone assist me here, please? Can someone assist me here, please? Let's review the birth plan before we start. Let's review the birth plan before we start. Vitals are stable, no changes from earlier. Vitals are stable, no changes from earlier. Could you prepare the meds while I set up the monitor? Could you prepare the meds while I set up the monitor? Patient is 6 centimeters and contracting every 3 minutes. Patient is 6 centimeters and contracting every 3 minutes. Let's debrief after this and make sure everything's documented. Let's debrief after this and make sure everything's documented. Can you double check her file for allergies? Can you double check her file for allergies? Let's call for the anaesthetist now. She's asking for an epidural. Let's call for the anaesthetist now. She's asking for an epidural. Do you want to escalate or wait another 10 minutes? Do you want to escalate or wait another 10 minutes? We'll update the family once we've stabilized everything here. We'll update the family once we've stabilized everything here. Fantastic work! These phrases make you a better team player, calm, clear, and always focused on patient safety. Which of these phrases would you use to update a colleague on labour progress? The correct answer is patient is 6 centimeters and contracting every 3 minutes. If you're finding this all very helpful, why not explore student membership? You'll get full access to the PDF version of the guide for this lesson, along with my complete library of guides and additional English lessons. You'll join my community and really start to boost your professional English. Okay, let's head into our second last section now, phrases for guiding someone through birth itself. This section follows on from topic 2. The baby is coming soon. You're doing brilliantly. The baby is coming soon. You're doing brilliantly. Keep breathing just like that. You've got it. Keep breathing just like that. You've got it. Try to push down into the pressure when the contraction comes. Try to push down into the pressure when the contraction comes. You're going to feel a strong urge to push. That's normal. You're going to feel a strong urge to push. That's normal. Let's try a new position to give the baby more space. Let's try a new position to give the baby more space. That was great. Now just rest and breathe between contractions. That was great. Now just rest and breathe between contractions. You're in control. Listen to your body. You're in control. Listen to your body. We're almost there. One more good push. We're almost there. One more good push. You might feel some burning. That means the head is crowning. You might feel some burning. That means the head is crowning. Here's your baby. You did it. Here's your baby. You did it. Amazing job. These phrases help guide one of the most powerful moments in someone's life with professionalism and care. Which of these phrases is used when the head is crowning? And yes, the correct answer is phrase number 89. You might feel some burning. That means the head is crowning. We're almost at the finish line. For our final topic, let's focus on phrases midwives use to empower, comfort, and support mothers throughout the journey. You're stronger than you think. You're stronger than you think. Everything you're feeling is completely valid. Everything you're feeling is completely valid. You're allowed to feel scared. I'm here with you. You're allowed to feel scared. I'm here with you. Every birth is different. There's no right way to feel. Every birth is different. There's no right way to feel. It's okay to ask for help. That's what we're here for. It's okay to ask for help. That's what we're here for. You're doing more than enough. You're doing more than enough. You don't have to be perfect. Just breathe. You don't have to be perfect. Just breathe. There's no rush. Take your time. There's no rush. Take your time. You're not alone. We're with you every step. You're not alone. We're with you every step. You've done something incredible. You've done something incredible. Wow, congratulations! You've just completed 100 English phrases for midwives, a full masterclass in real, compassionate professional language for maternity care. If you've enjoyed this lesson, why not get the PDF guide, which is available right now for my student members. Student membership comes with loads of additional benefits, including my full PDF guide directory, which includes over 70 professional English guides. You'll also gain access to 200 English lessons on YouTube for my members only. And got an idea for an English professional lesson? Let me know. Your request gets priority as a student member. You can also pick up the guide in my YouTube store for just $4.99 as a one-time purchase. Now don't go anywhere. Up next, we're diving into more essential lessons in medical English to support your skills and career. And first up is a lesson on Paediatric Vocabulary, very useful for midwives. Thank you so much for joining me today, and I'll see you in the next lesson. Welcome to the latest medical English learning video from my channel, Learning English Pro. In this video, we will dive into the medical field of pediatrics. This is a medical specialty which focuses on the care of children. I will explain this area of medicine to you in simple English with lots of definitions and medical terminology along the way. We will be taking a look at some of the differences between a doctor treating a child and treating an adult and the reasons why this is necessary. Okay, if you're ready, let's get started learning all about pediatrics in English. Let's take a look at our first word in our lesson, which of course is pediatrics. And as you can see on screen, there are 3 different spellings for this. For the duration of this video, we'll be sticking with the first spelling. And let's take a look at the definition. Pediatrics is the branch of medicine that involves the medical care of infants, children, and adolescents or teenagers. In the United States of America, pediatric care is usually available to people until they reach the age of 21. However, in other parts of the world, pediatric care is usually offered until the age of 18. A doctor who specializes in this area is known as a pediatrician. Let's practice this word a few times. Pediatrician. Pediatrician. One more time. Pediatrician. And pediatricians generally work in hospitals and children's hospitals. The oldest traces of pediatric care can be found in ancient India and ancient Greece. But paediatrics as we know it didn't come around till much later. The Swedish physician Niels Rosen von Rosenstein is considered to be the founder of modern paediatrics as a medical speciality. The first generally accepted paediatric hospital is the Hôpital des Enfants Malades, which opened in Paris in June 1802 on the site of a previous orphanage. From its beginning, this famous hospital accepted patients up to the age of 15 years, and it continues to operate as a children's hospital to this day. Okay, let's move on and have a look at the differences between adult and paediatric medicine. And the reason there is a difference is because there is a substantial physiological difference between the body of a child and that of an adult. Let's take a look at a definition of this adjective physiological. This word means anything relating to the branch of biology that deals with the normal functions of living organisms and their parts. And because of children's age, congenital defects, genetic variants, and developmental issues are of greater concern to paediatricians than they often are to adult physicians. Let's take a look at some of these issues in greater detail. Congenital defects can be defined as structural or functional anomalies that occur during pregnancy. These can also be called birth defects, congenital disorders, or congenital malformations. These conditions develop prenatally and may be identified before or at birth or later in life. Genetic variation refers to diversity in gene frequencies. Gene variation can refer to differences between individuals or to differences between populations. Mutation is the ultimate source of genetic variation, but mechanisms such as sexual reproduction and genetic drift contribute to it as well. Developmental issues include delays or abnormal patterns of development in the areas of communication or language, motor skills, problem solving, or social and adaptive behaviour. These concerns are usually based on comparison to children of the same age. Another important aspect of paediatrics is medication, and a child's physiology directly impacts the properties of drugs that can enter the body. The absorption, distribution, metabolism, and elimination of medications differ between developing children and grown adults. And let's take a look at some of the highlighted terminology in screen in greater detail. So first up we have absorption, and this is a condition in which something takes in another substance. So we would say that drug absorption is the process of a drug moving from its site of delivery, like the mouth, into the bloodstream. And many drug absorption differences between paediatric and adult populations revolve around the stomach. Young infants have different levels of acid in their stomachs, which creates a more basic environment for drugs taken orally. Our next bit of terminology is distribution. This describes the way in which something is shared out amongst a group or spread over an area. The word distribution is usually referred to in relation to the movement of goods, but drug distribution refers to the movement of a drug to and from the blood and various tissues of the body, like fat, muscle, and brain tissue, and the relative proportions of the drug in these tissues. The percentage of total body water and fluid volume decrease as children grow and develop with time. Therefore, children have a larger volume of distribution than adults, which directly affects the dosing of drugs given to them. Our next English word is metabolism. Metabolism is the chemical reactions in the body cells that change food into energy. Drug metabolism is the metabolic breakdown of drugs by living organisms, usually through specialized systems. Drug metabolism primarily occurs via enzymes in the liver and can vary according to which specific enzymes are affected in a specific stage of development. Next up, we have elimination. And this word describes the complete removal or destruction of something, or the expulsion of waste matter from the body. And in humans, drug elimination is primarily facilitated via the liver and kidneys. In infants and young children, the larger relative size of their kidneys leads to increased renal clearance of medications that are eliminated through urine. Our next topic of discussion is pediatric autonomy in healthcare. Now, what does the word autonomy mean? Let's take a look at the definition. Autonomy is the capacity to make an informed, uncoerced decision, or it can be called freedom from external control or influence, or independence. Simply put, it's the freedom to make decisions for yourself and your own body. So this word is important when we talk about pediatric healthcare. A major difference between the practice of pediatric and adult medicine is that children in most jurisdictions, and with certain exceptions, cannot make decisions for themselves. The issues of guardianship, privacy, legal responsibility, and informed consent must always be considered in every pediatric procedure. And that brings us to the end of our lesson. Let me know in the comments what was useful today to you in this lesson. Welcome to this English vocabulary lesson on babies. Yes, we are diving into the world of newborn babies and learning lots of related English vocabulary. Like, what other words can we use instead of baby? What verbs and nouns are used to describe the birth? And how do we talk in English about the baby's weight, condition, feeding, and much, much more? Make sure to check out the extensive word list in the description below. Okay, let's get started with our English lesson on babies. Are you ready? The first word we will have a look at is, of course, baby. This noun has no gender in English, so if we need to inform the gender, we need to add some additional words. You would simply say baby girl or baby boy to inform someone of a baby's gender. Synonyms of baby include newborn, and this noun is used to describe babies from 0 to 2 months old. The word infant can also be used to describe babies up until the first year. Other common synonyms of baby include nouns such as child, tot, and the term little one. Interestingly, in Scottish slang, we have 2 unique words for babies. My Scottish friend Lizzie tells me that the word wain is used on the west coast and barn is used in the east coast of Scotland. Let's move on to our next word, birth, which is a noun and it describes the event of the arrival of a baby. Let's take a look at an example sentence. The birth went well. The birth went well. Another word we can use is the adjective born. We could say, the baby was born this morning. There is also the phrasal verb gave birth, which is commonly used. A mother might say, I gave birth to my child. Or we could say, my sister gave birth to her son in the evening. And we can also use the regular verb to arrive. An example sentence is, the baby arrived today. Let's do that one more time. The baby arrived today. Next up in our baby vocabulary, let's talk about the noun weight. Weight is how heavy something is, and a newborn baby generally weighs about 3.4 kilograms or 7.5 pounds. Babies born with this approximate weight are said to have a healthy weight, a good weight, or a normal weight. We also have the adjectives premature or preterm. These words describe babies born before a full term of pregnancy, and premature babies may need to be put inside an incubator. And this is because they may need some time to develop a little bit more. Something a lot of new mothers will have experience with is the regular verb to cry. We also have the useful adjective crying. Let's take a look at these two words in action in some example sentences. Our first example is, the baby cries every night. Next up, the baby cried last night. The crying baby is loud. The baby is crying. A big part of parenting is understanding the reasons why a baby is crying. It might be because of loneliness, or perhaps the baby is uncomfortable. Another reason could be overstimulation, or maybe the opposite, boredom. Maybe your baby is wanting something, or perhaps your baby has hunger and wants some food. That brings us to our next noun, which is feeding, which describes the event of giving food to your child. We also have the irregular verb to feed. It's irregular in the past tense when it changes to fed. Bear this in mind as we come across similar verbs later in the video. When a mother feeds a child directly from her own body, this event is called breastfeeding. And lots of scientists and health services around the world agree that breastfeeding is best for your baby. Breastfeeding is also a past participle of the irregular verb to breastfeed. In the present continuous tense, we could say, she is breastfeeding or I am breastfeeding. And as I mentioned, this comes from the irregular verb to breastfeed. Let's take a look at this verb in a simple present tense example. She breastfeeds her baby. She breastfeeds her baby. And in the simple past tense, we have she breastfed her baby this morning. So if you remember the verb to feed, here we have breastfed without the double E at the end, just one E, breastfed. And of course, breast milk is produced during breastfeeding. Breast milk. Lots of mothers will use bottle feeding. This noun describes the action of feeding your baby with a bottle. And of course, we have the verb form, bottle feed. And this verb follows the same pattern as feed and breastfeed in the past tense, bottle fed. Lots of mothers will also use a breast pump. This noun describes the device which helps mothers express their milk into bottles. And we can use the verb to pump to describe this action. An example sentence is, Pamela pumps her breast milk with her breast pump. There is also the option to feed your baby with baby formula. In the United States, this is often called instant formula. This is a type of powdered milk used to feed newborn and older babies. And of course, what goes in must come out. Next up, we have the noun diaper. This is the word used in American English to describe the kind of cloth underwear used for babies. And in British English, this item of clothing is called a nappy. A regular verb which is often used with nappy or diaper is change. Let's take a look at some examples. I changed his diaper. In the present simple, John changes the baby's diaper. And in the future simple tense, we could say, they will change Chloe's nappy. And at some point, your baby will need to sleep, and they can do this in the crib. This is what we call a baby's bed. But there are lots of other synonyms, like cradle. Commonly used in America is bassinet. And in the UK, it is commonly called a cot. And that brings us to the end of this English lesson on babies. On my YouTube. Hello and welcome to Learning English Pro. I'm Jer, your online English teacher and guide. Today we're diving into 100 common medications, learning about different types of medications, their uses, symptoms they treat, and correct pronunciation. This lesson will help you sound confident and professional when discussing these medications in English. To make your learning even more comprehensive, I've created a PDF guide for this lesson, which includes all the content we'll cover. This guide is available exclusively to student members of my channel. Becoming a member gives you access to much more: the PDF guides, early video access, online games, quizzes, weekly flashcards, and additional resources on the way. It's a fantastic way to take your learning further and get even more value from each lesson. If you're interested in these extra tools and support, consider joining the student membership for the price of a cup of coffee. It's a great way to support the channel, deepen your English language skills, and stay connected with all the new content on the channel. Now let's get started with our lesson on 100 common medications. We will go through 20 different types of medication, starting with an explanation, followed by a list of example medications, and then some example English sentences. If you are looking for healthcare advice on medications or symptoms, then ask a healthcare professional like a doctor or a nurse. So if you're ready, let's get started. Our first medication type is anesthesia. Now on screen you can see here that we have two different spellings, one for American English and the other for British English. Anesthesia is used to induce a loss of sensation or consciousness, often for surgical procedures. These medications may be general, affecting the entire body, or local, targeting a specific area. Anesthetics are essential in pain-free medical interventions. Different types of anesthesia include propofol. This is used for general anesthesia and is commonly known as the Michael Jackson drug. Lidocaine. This is a local anesthetic, often used in dental procedures. Isoflurane is a gas anesthetic commonly used during surgeries. Ketamine is a powerful anesthetic also used in emergency pain management. Bupivacaine is a long-acting local anesthetic used in epidurals. Let's take two of these words and use them in example sentences. The surgeon administered propofol to induce general anesthesia before the procedure. For minor dental work, the dentist used lidocaine to numb the area. Our next category of medicine is painkillers, also called analgesics. These medications are ones that relieve pain. They range from mild, over-the-counter options to stronger prescription drugs. Painkillers are classified into non-opioid, opioid, and NSAIDs. Different types of painkillers include aspirin, a common over-the-counter pain reliever and anti-inflammatory. Ibuprofen. This treats mild to moderate pain. Morphine. This is a powerful opioid painkiller for severe pain. Acetaminophen, also known as Tylenol, is used for mild pain and fever. Codeine is an opioid used for pain relief and sometimes in cough syrups. After the surgery, the doctor prescribed morphine to manage the patient's pain. Ibuprofen is often recommended for reducing inflammation and mild pain. Our next medicine category is antibiotics. Antibiotics are medications that kill or inhibit the growth of bacteria, used to treat bacterial infections. They are not effective against viruses and should be only used as prescribed to prevent antibiotic resistance. Amoxicillin is a widely used antibiotic for bacterial infections. Azithromycin treats respiratory and skin infections. Ciprofloxacin is an antibiotic often prescribed for urinary tract infections. Doxycycline is used to treat various infections, including acne. Penicillin, one of the oldest antibiotics, is still used for specific bacterial infections. Let's take a look at our example sentences. The patient was prescribed amoxicillin for a bacterial throat infection. For skin infections, doxycycline is a common and effective choice. Let's move on to antidepressants. These are medications used to treat depression, anxiety, and certain other mood disorders. They work by balancing chemicals in the brain to improve mood, sleep, and energy levels. Our first antidepressant is fluoxetine. This is commonly known as Prozac. It treats depression and anxiety. Sertraline, known as Zoloft, is used for depression, anxiety, and PTSD. Amitriptyline is an older antidepressant, which is also used for chronic pain. Escitalopram, also known as Lexapro, is used for depression and generalized anxiety disorder. Venlafaxine treats major depressive and anxiety disorders. Fluoxetine is often prescribed for patients experiencing chronic depression. Sertraline is commonly used to manage both depression and anxiety. Our next medication classification is antipsychotics. This type of medication is used to manage psychosis, including schizophrenia and bipolar disorder. They help reduce hallucinations, delusions, and other severe mental health symptoms. Risperidone is used to treat schizophrenia and bipolar disorder. Olanzapine is prescribed for bipolar disorder and schizophrenia. Clozapine is used for treatment-resistant schizophrenia. Quetiapine treats both bipolar disorder and depression. And we have aripiprazole, which is also used for schizophrenia and bipolar disorder. The patient was given risperidone to help manage symptoms of schizophrenia. Olanzapine is effective for treating mood swings in bipolar disorder. Next up, we have antihistamines. Antihistamines relieve allergy symptoms by blocking histamine, a substance in the body that causes allergic reactions. They are used for conditions like hay fever, itching, and some respiratory allergies. Loratadine, also known as Claritin, is commonly used for seasonal allergies. Diphenhydramine, also known as Benadryl, relieves allergies and cold symptoms. Cetirizine treats hay fever and skin allergies. Fexofenadine is used for seasonal allergy symptoms. Hydroxyzine is used for itching and anxiety, often in short-term settings. Loratadine is effective for relieving symptoms of seasonal allergies. For severe itching, hydroxyzine may be prescribed as an antihistamine. Our next medication category is diuretics, also known as water pills. This type of medication helps the body eliminate excess fluid by increasing urine production. They're commonly prescribed for conditions like hypertension, heart failure, and kidney issues. Our first diuretic is furosemide. This drug is commonly used for heart failure. Hydrochlorothiazide treats high blood pressure and fluid retention. Spironolactone is a potassium-sparing diuretic used for fluid retention. Bumetanide is used to reduce swelling due to fluid buildup. Chlorthalidone is a diuretic often prescribed for hypertension. Let's check out our example sentences. The doctor prescribed furosemide to manage the patient's heart failure symptoms. Hydrochlorothiazide is commonly used to treat high blood pressure. Our next medication category is anticoagulants. These are often referred to as blood thinners. Anticoagulants prevent blood clots, reducing the risk of stroke, heart attack, and other cardiovascular issues. They are vital for patients at high risk of blood clots. Our first type is warfarin. Warfarin is a commonly used blood thinner. Next up, we have heparin, which is often used in hospitals for blood clot prevention. Dabigatran is an oral anticoagulant. Apixaban is used to reduce stroke risk. Rivaroxaban is a blood thinner for clot prevention. Warfarin is often prescribed to patients with an elevated risk of stroke. Apixaban is taken daily to prevent blood clots in high-risk individuals. Let's move on to anti-inflammatory drugs, otherwise known as NSAIDs. This type of medication is used to reduce inflammation, pain, and fever. They're commonly available over the counter and treat various conditions, from arthritis to headaches. Our first type of anti-inflammatory is ibuprofen. This is commonly known in the United States as Advil, a common NSAID. Naproxen is used for pain and inflammation. Celecoxib is often used for arthritis. Indomethacin is used to reduce inflammation in arthritis. Diclofenac is often prescribed for severe pain and inflammation. Ibuprofen is often used to reduce inflammation and treat mild pain. For joint pain, naproxen can be effective in reducing inflammation. Let's move on to antacids and acid reducers. This type of medication is used to relieve symptoms of acid reflux, heartburn, and indigestion. Antacids neutralize stomach acid, while acid reducers lower acid production in the stomach. Omeprazole is used for acid reflux and GERD. Ranitidine is commonly used for heartburn, but it is now discontinued in many markets across the world. Calcium carbonate, also known as the brand Tums, is an over-the-counter antacid. Famotidine is used to reduce stomach acid. Esomeprazole is used for acid reflux. Omeprazole is often prescribed for patients with chronic acid reflux. For quick relief, calcium carbonate can neutralize stomach acid on the spot. Let's move on to bronchodilators or respiratory medications. This type of drug is one that helps open the airways in the lungs, making breathing easier. They are commonly prescribed for asthma, COPD, and other respiratory conditions. Albuterol is commonly used for asthma attacks. Ipratropium is used for COPD. Salmeterol is a long-acting bronchodilator. Theophylline is used for asthma and other lung diseases. Tiotropium is used for long-term COPD management. Let's check out our example sentences. During an asthma attack, albuterol provides quick relief by opening the airways. Salmeterol is often prescribed for patients needing long-term asthma control. Our next medicine category is antivirals. Antivirals are medications that treat viral infections by inhibiting the development of the virus. They are used for conditions like flu, herpes, and HIV. Our first antiviral is acyclovir. This is known as Civirix, and it's used for herpes infections. Oseltamivir, also known as Tamiflu, is used for influenza. Valacyclovir is used for herpes and shingles. Tenofovir is used for hepatitis B and HIV. Remdesivir is used for COVID-19 in specific settings. Acyclovir is prescribed to help manage herpes symptoms. For flu symptoms, oseltamivir is often recommended during flu season. Our 13th category of medication is anti-diabetics. Anti-diabetic medications help manage blood sugar levels in people with diabetes. These include insulin and various oral medications. Metformin is a commonly prescribed medication for type 2 diabetes. Insulin is a hormone used to control blood sugar, often injected. Glipizide stimulates insulin production. Sitagliptin helps control blood sugar. Next up, we have pioglitazone. This medication helps regulate glucose. Let's take a look at our example sentences. Patients with type 2 diabetes are often started on metformin to control blood sugar. Insulin injections are necessary for many patients with type 1 diabetes. Next up, we have corticosteroids, or commonly just referred to as steroids. These medications are used to treat a wide range of conditions, including asthma, allergies, and arthritis. They work by reducing inflammation and immune response. Prednisone is used for inflammation and autoimmune conditions. Hydrocortisone is available as a cream for rashes and inflammation. Dexamethasone is a powerful steroid used in severe inflammation cases. Methylprednisolone is used for severe allergies. And betamethasone is often used as a topical cream for skin conditions. Prednisone is commonly prescribed for patients with severe allergies. For joint inflammation, methylprednisolone can provide relief. Our next category of medication is laxatives and stool softeners. This type of medication helps relieve constipation by promoting bowel movements or softening stool, making it easier to pass. Psyllium, also known as Metamucil, is a fiber-based laxative. Next up, we have Docusate, which is a stool softener. Polyethylene glycol is used for constipation. There is also Senna, a herbal laxative available over the counter. Bisacodyl, also known as Ducalex, stimulates bowel movements. Let's check out our example sentences. First up, polyethylene glycol is recommended for chronic constipation. Docusate is a gentle option for softening stool without causing cramps. Our 16th category of medications is antihypertensives, also known as blood pressure medications. Antihypertensives are used to control high blood pressure, reducing the risk of heart attack, strokes, and kidney disease. Lisinopril is an ACE inhibitor used to lower blood pressure. Amlodipine is a calcium channel blocker. Losartan is an angiotensin II receptor blocker, or A or B. Metoprolol is a beta blocker also used for heart rate control. Hydrochlorothiazide is a diuretic also used to lower blood pressure. The doctor prescribed lisinopril to manage the patient's high blood pressure. Amlodipine helps relax blood vessels, making it easier for blood to flow. Our next type of medication is muscle relaxants. Muscle relaxants relieve muscle spasms and tightness, often prescribed for back pain, muscle injuries, and other painful conditions. First up, we have cyclobenzaprine. This is a common muscle relaxant. Methocarbamol is used for muscle pain. Baclofen is used for muscle spasticity in neurological conditions. Up next, we have tizanidine, which treats muscle tightness. Diazepam, also known as Valium, is used as a muscle relaxant and anti-anxiety medication. Cyclobenzaprine is commonly used for relief from muscle spasms. For chronic muscle tightness, tizanidine may be prescribed. Our 18th category of medication is anti-seizure medications or anticonvulsants. This type of medication prevents or reduces the frequency of seizures. They are essential in the treatment of epilepsy and may be used for mood stabilization or neuropathic pain. Phenytoin is commonly used for epilepsy. Carbamazepine treats seizures and nerve pain. Valproate treats seizures and is also used for bipolar disorder. Up next, we have levetiracetam. This is a newer anti-seizure drug. Gabapentin is used for nerve pain and seizures. Let's check out our example sentences. Phenytoin is prescribed to control seizure activity in epilepsy. For neuropathic pain, gabapentin is commonly used as an off-label treatment. Our penultimate category is for antiemetics, also known as nausea relief. These types of medications are used to prevent or relieve nausea and vomiting, commonly prescribed for patients undergoing chemotherapy, surgery, or those with severe motion sickness. Ondansetron is a medication widely used to prevent nausea. Metoclopramide treats nausea and aids digestion. Prochlorperazine is used for severe nausea. Promethazine treats nausea and motion sickness. Scopolamine is a patch or tablet often used for motion sickness. Patients receiving chemotherapy are often prescribed ondansetron to manage nausea. Promethazine is a go-to medication for preventing motion sickness on long journeys. Our final category of medication is immunosuppressants. Immunosuppressants are medications that suppress the immune system, commonly used for patients with autoimmune diseases or those who have undergone organ transplants to prevent rejection. Cyclosporine is often used to prevent organ transplant rejection. Methotrexate is used for autoimmune conditions like rheumatoid arthritis. Azathioprine is used for lupus and Crohn's disease. Tacrolimus is often used for kidney and liver transplant patients. Mycophenolate is an immunosuppressant used after organ transplants. Cyclosporine is essential for patients who have undergone organ transplants. For managing autoimmune conditions, methotrexate can be an effective treatment. And there we have it. Thank you for joining me for this lesson on 100 common medications in English. I hope you found it useful in building your confidence with medical English. Remember, the key to mastering this vocabulary is practice and repetition, so feel free to revisit this lesson as often as you need. For those of you looking to take your learning even further, don't forget that the student membership on Learning English Pro offers an exclusive PDF guide for this lesson, along with early access to videos, interactive quizzes, online games, weekly flashcards, and so much more to support your progress. It's a valuable resource packed with tools to enhance your skills, and all for the price of a cup of coffee once a month. Anyway, thank you for watching, and please share this lesson with friends and colleagues. Tutor and guide. In this lesson, you will learn 100 English phrases for patient care. This is great for nurses and other healthcare workers. In the world of healthcare, the quality of patient care is paramount. Whether you are a nurse, caregiver, or healthcare assistant, the way you interact with patients can significantly impact their overall experience and recovery. In this lesson, we will explore key phrases and techniques that are essential for providing excellent patient care. We'll cover a range of topics, including morning activities, bathing and bathroom, toilet assistance, emotional support, encouraging mobility and exercise, communication with family, and transitioning care. Each section will provide you with practical sentences and tips to improve your communication and caregiving skills. By mastering these key phrases, you'll be better equipped to create a positive and supportive environment for your patients. Our first topic is morning activities. Good morning, how are you today? Good morning, how are you today? Hello, I'm Jer, your nurse for today. Hello, I'm Jer, your nurse for today. Hi there, nice to see you again. Hi there, nice to see you again. How did you sleep last night? How did you sleep last night? I hope you had a restful night. I hope you had a restful night. Would you like help getting dressed? Would you like help getting dressed? What would you like to wear today? What would you like to wear today? Let's get you into some fresh clothes. Let's get you into some fresh clothes. Can I assist you with your shoes? Can I assist you with your shoes? Do you need help with your buttons? Do you need help with your buttons? Let's move on to our next topic, which are phrases for bathing and the bathroom. Would you like a bath now? Would you like a bath now? I'll help you get to the bathroom. I'll help you get to the bathroom. Do you need assistance with your bath? Do you need assistance with your bath? Let's get you freshened up. Let's get you freshened up. I'll help you with your hygiene needs. I'll help you with your hygiene needs. Is the water temperature okay? Is the water temperature okay? Do you need help getting in or out of the tub? Do you need help getting in or out of the tub? Would you prefer a shower instead? Would you prefer a shower instead? I'll assist you with washing. I'll assist you with washing. Let's make sure you're comfortable and clean. Let's make sure you're comfortable and clean. Next up, we have some English phrases you might use to help a patient to use the toilet. Do you need to use the bathroom? Do you need to use the bathroom? I can help you get to the toilet. I can help you get to the toilet. Let's take a trip to the bathroom. Let's take a trip to the bathroom. Do you need assistance with your clothing? Do you need assistance with your clothing? I'll be here if you need help. I'll be here if you need help. Would you like some privacy while you use the toilet? Would you like some privacy while you use the toilet? I'll help you wash your hands afterward. I'll help you wash your hands afterward. Let's make sure you're comfortable on the toilet. Let's make sure you're comfortable on the toilet. Do you need help getting up? Do you need help getting up? I'll assist you back to your bed or chair. I'll assist you back to your bed or chair. Well done, you're doing great. You've already learned 30 English phrases. Next up, we have English phrases relating to giving medication to a patient. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Do you have any allergies? Do you have any allergies? Let's take your pills with some water. Let's take your pills with some water. This is your medication for today. You could add in the name of the medication here. This is your aspirin for today. I'll check on you after you take your meds. I'll check on you after you take your meds. Let me explain what this is for. Let me explain what this is for. Please let me know if you feel any side effects. Please let me know if you feel any side effects. Remember to take this with food. Remember to take this with food. Do you need a reminder for your next dose? Do you need a reminder for your next dose? Our next topic is phrases related to meals and feeding. It's time for breakfast. It's time for lunch. It's time for dinner. Can I help you with your meal? Can I help you with your meal? What would you like to eat today? What would you like to eat today? Do you have any dietary restrictions? Do you have any dietary restrictions? Let's make sure you're getting enough nutrients. Let's make sure you're getting enough nutrients. Would you like some water or juice? Would you like some water or juice? Are you enjoying your meal? Are you enjoying your meal? Can I help you with your utensils? Can I help you with your utensils? Let me know if you need more to eat. Let me know if you need more to eat. I'll check back in a bit to see how you're doing. I'll check back in a bit to see how you're doing. Our next topic covers phrases related to helping patients with their feelings, emotional support. How are you feeling today? How are you feeling today? Would you like to talk about anything? Would you like to talk about anything? I'm here to listen if you need to talk. I'm here to listen if you need to talk. It's okay to feel the way you do. It's okay to feel the way you do. How can I make things better for you? How can I make things better for you? You're doing a great job. You're doing a great job. Let me know if you need some quiet time. Let me know if you need some quiet time. Would you like to speak with a counselor? Would you like to speak with a counselor? I'm here to support you. I'm here to support you. Take your time. I'm here for you. Take your time. I'm here for you. These phrases are going to be very useful to any nurse or healthcare worker. Next up, let's take a look at some conversation starters. These phrases are really useful when you want to get to know your patient a bit better. What's your favorite book? What's your favorite book? Do you enjoy any hobbies? Do you enjoy any hobbies? Tell me about your family. Tell me about your family. What kind of music do you like? What kind of music do you like? Have you travelled much? Have you travelled much? What's your favourite movie? What's your favourite movie? Do you have any pets? Do you have any pets? What was your profession? What was your profession? Tell me about your childhood. Tell me about your childhood. Do you have any favourite recipes? Do you have any favourite recipes? We are certainly working our way through our 100 English phrases for patient care. Our next topic is encouraging mobility and exercise. Let's go for a short walk. Let's go for a short walk. Would you like to do some stretches? Would you like to do some stretches? It's important to stay active. It's important to stay active. Can I help you with some exercises? Can I help you with some exercises? How about a walk around the hall? How about a walk around the hall? Let's do some gentle movements. Let's do some gentle movements. Do you feel up to some physical activity? Do you feel up to some physical activity? I'll assist you with your exercises. I'll assist you with your exercises. Let's work on your strength and mobility. Let's work on your strength and mobility. We can take it slow and steady. We can take it slow and steady. Our ninth topic is communication with family. Would you like to call your family? Would you like to call your family? Can I help you video chat with your loved ones? Can I help you video chat with your loved ones? Do you want me to update your family on your condition? Do you want me to update your family on your condition? Is there a family member you'd like to speak with? Is there a family member you'd like to speak with? I can assist with arranging a visit. I can assist with arranging a visit. Let's keep your family informed. Let's keep your family informed. Would you like to write a letter or email? Would you like to write a letter or email? I can help you send a message. I can help you send a message. Is there anything you want me to tell your family? Is there anything you want me to tell your family? I'll make sure your family knows how you're doing. I'll make sure your family knows how you're doing. And now we are at our final topic. In this segment, we'll learn phrases for communicating about the end of our shift and transitioning care to another nurse or healthcare worker. My shift is ending soon. My shift is ending soon. I'll introduce you to the next nurse. I'll introduce you to the next nurse. Is there anything you need before I go? Is there anything you need before I go? I've informed the next nurse about your needs. I've informed the next nurse about your needs. I hope you have a restful night. I hope you have a restful night. I'll be back to check on you tomorrow. I'll be back to check on you tomorrow. Thank you for allowing me to care for you. Thank you for allowing me to care for you. I'll make sure the next nurse knows your preferences. I'll make sure the next nurse knows your preferences. Please let the night nurse know if you need anything. Please let the night nurse know if you need anything. It's been a pleasure taking care of you. It's been a pleasure taking care of you. Well done, you've just learned 100 English phrases for nurses and healthcare workers for patient care. You've done a fantastic job. In today's lesson, we're going to explore the essential tools and equipment that every nurse needs to provide the very best in patient care. So this lesson promises to be a masterclass in English for nurses and those interested in the medical field. Let's begin our first lesson, essential nursing tools and equipment. Let's get started. Our first piece of equipment is the stethoscope. Repeat after me. Stethoscope. The stethoscope is an instrument used by nurses and doctors to listen to the sounds made by the heart, lungs, and other organs. Let's use this word in a sentence. Let me use my stethoscope to listen to your heart and lungs. Our next piece of equipment is a blood pressure monitor. Blood pressure monitor. This device is used to measure blood pressure, typically consisting of an inflatable cuff and a measuring unit. I need to check your blood pressure with this monitor. Please relax your arm. Next up, we have the thermometer. Repeat after me. Thermometer. This instrument is used for measuring and indicating temperature, commonly used to check a patient's body temperature. I'll take your temperature with this digital thermometer. It will only take a few seconds. Let's move on to pulse oximeter. Pulse oximeter. The pulse oximeter is a non-invasive device that measures the oxygen saturation level of the blood. Let's try it out in a sentence. I'm going to place this pulse oximeter on your finger to check your oxygen levels. Next up, we have glucometer. Glucometer. This device is used to measure the approximate concentration of glucose in the blood. Let's use the glucometer to check your blood sugar levels before your meal. Our next term is commonly mispronounced as syringe. The correct pronunciation is syringe. Repeat after me. Syringe. A syringe is a medical instrument used to inject fluids into or withdraw them from the body. I need to give you an injection, so I'll prepare this syringe. Let's move on to IV drip or intravenous drip. So we have IV drip or intravenous drip. This is a method of delivering fluids, medications, or nutrients directly into a patient's vein. Let's try it out in a sentence. We'll set up an IV drip to make sure you get the fluids you need. Our next term is tricky to say. Catheter. Catheter. Let's try it one more time. Catheter. A catheter is a tube that can be inserted into a body cavity, duct, or vessel to allow for drainage, injection of fluids, or access by surgical instruments. Let's check out our sentence example. I'm going to insert a catheter to help you with urination. Next up, we have bandages. Bandages. Bandages are strips of material used to bind a wound or to protect an injured part of the body. After cleaning the wound, I'll apply these bandages to protect it from infection. Let's move on to defibrillator. Defibrillator. This life-saving device is one that delivers a dose of electric current or shock to the heart to restore a normal heartbeat. Let's check out our sentence example. In case of an emergency, the defibrillator is used to restart the heart. Scalpel. Repeat after me. Scalpel. A scalpel is a small and sharp knife used in surgeries and medical procedures. Please hand me the scalpel for the incision. Next up, we have gloves. Repeat after me. Gloves. Gloves are a protective covering for the hands worn by medical professionals to prevent contamination and spread of infection. I always wear gloves to maintain hygiene while treating wounds. Our next piece of equipment is a face mask. Face mask. This is a protective mask covering the nose and mouth, or nose, mouth and eyes, worn to reduce the spread of infectious agents. Please wear this face mask to protect yourself and others. Gown. Gown. A nurse's gown is a protective garment worn by medical staff during surgical procedures or patient care to maintain hygiene. Let's try it in a sentence example. I'll put on a sterile gown before assisting in the surgery. Let's move on to tuning fork. Tuning fork. A tuning fork is a tool that provides a fixed tone when struck. This is used to test hearing or vibration sense. I'm using this tuning fork to check your hearing. Our next piece of equipment is the otoscope. Otoscope. An otoscope is a device used to look into the ears to examine the ear canal and eardrum. I'll use the otoscope to check for any signs of ear infection. A similar tool is the pen light. Pen light. This device is a small flashlight used to examine patients, especially to check pupil responses. Let's try it in a sentence. I'll use this pen light to check your pupils for any abnormalities. Next up, we have walker. Walker. A walker is a framework used for support when walking, typically for elderly or injured patients. Use the walker to help you move around safely after your surgery. Wheelchair. Wheelchair. A wheelchair is a chair fitted with wheels, used by people who cannot walk or who have difficulty walking. Let's take a look at our sentence example. I'll take you to your room in a wheelchair for your comfort. Next up, we have crutches. Crutches. Crutches are mobility aids that help a person walk when they have an injury or disability affecting the legs or feet. I'll teach you how to use the crutches to move around safely. Our next piece of equipment is the sterilizer. Sterilizer. The sterilizer is a device used to sterilize medical instruments to ensure they are free of all microorganisms. Let's try it in a sentence. All surgical tools must go through the sterilizer before being used. Our next term is medical chart. Medical chart. A medical chart is a comprehensive record of a patient's medical history and treatment. Make sure to update the patient's medical chart with today's observations. Let's move on to suction machine. Suction machine. A suction machine is a device used to remove bodily fluids from a patient's airway or surgical site. During the procedure, we used a suction machine to clear the airway. Our next piece of equipment is called an ECG machine or electrocardiogram. So ECG machine or electrocardiogram. This device is used to measure the electrical activity of the heart. Let's try it in a sentence. We'll use the ECG machine to monitor your heart's activity. Our final piece of equipment for this part of our lesson is the nebulizer. Nebulizer. This is a device that administers medication in the form of a mist inhaled into the lungs. Let's take a look at our final sentence. I'll set up the nebulizer to help you with your breathing treatment. Well done, you've done a great job of learning 25 terms for essential nursing tools and equipment. Let's move on to our next lesson, which is 100 phrases for nurses. These phrases are essential for daily interactions with patients, doctors, and other healthcare professionals. So whether you're a beginner or have some experience, this lesson is designed to enhance your communication skills in a medical setting. So let's get started. Grab your notebooks and let's dive into today's lesson. Remember, practice makes perfect, and I'm here to support you every step of the way. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our 5th topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff.